How to use a blood pressure chart. To work out where you stand on a blood pressure chart, just use the line on the left, which is your systolic, your higher blood pressure level, and the line at the bottom, which is the lower level. Where the two meet, that's your blood pressure. On the whole, your doctor's going to diagnose you with high blood pressure if your blood pressure is consistently above about 140/90, or if you're measuring it at home and your average is above about 135/85. Between 120/80 and 140/90 is what we call high normal blood pressure, or sometimes pre-hypertension. It doesn't mean you've got high blood pressure, but it's a little bit higher than ideal, and it's often a warning sign that you really need to do something about it. Blood pressure in the region of 120/80 or a little bit lower is ideal. Once it drops much below that though, below say 90 for the upper level, you may find yourself feeling a little bit lightheaded. You may have hypotension, low blood pressure. This isn't usually a problem, but it can make you feel a bit odd.